For relapsing remitting multiple sclerosis, we have a lot of treatments, and we can now treat the inflammatory component of the disease. What's missing is just to try to limit, or if we can, improve the disability in patients and reverse the worsening phase of the disease. Maybe it's possible that the progressive phase starts very early. And the question will be, do we have to start treating this phase very early? If we consider progressive multiple sclerosis, we know now that there is still an inflammatory component. So treating progressive MS may start, and maybe should start, with treating this percentage that is variable of inflammatory component. And then we have to think about other strategies, therapeutical strategies, that may limit the neurodegeneration in the disease, and maybe, if we can, repair and remyelinate the nude axons. The research for the 20 or 25 past years was focused on the treatment of inflammation, and we have a lot of models and a lot of drugs that were developed in this perspective. And knowing that axon is maybe lesioned in MS is something that we knew for a long time, but maybe we thought that it was less injured than the myelin. And now we know that the axons are very early injured, so it's very important to think that we must develop this kind of strategies, and this was delayed comparatively to the development of the very strong anti-inflammatory drugs. There are drugs that are coming that are very powerful in treating inflammation, and we think that if we can stop definitely this component of the disease, then we can gain in a variable way. That's what I said when I start. And it's very important to add to these strategies other strategies that could protect the neurons. What happens in multiple sclerosis is that the demyelination puts the neuron in a state of virtual hypoxia, because when myelin is not there to protect the neuron, then the axons need a lot of more ATP molecules, a lot of more energy. And when they do this, it's just like a disequilibrium, which is very important between the energy supply and energy consumption. And then this state of virtual hypoxia will lead to the degeneration of the neuron. So what could be important is to restore the conduction of the neuron. And for this, it's very important to add energy, to give more energy supply to the neuron, and to think about other strategies that may restore the conduction and restore the myelin around the neuron. These could be the main strategies for treating patients, and the main strategies for the future. Maybe what we can think about is to use some anti-epileptic drugs that may restore conduction over the neuron. This may help to limit neurodegeneration. We have now some hypotheses about the drugs that may enhance the Krebs cycle, and if we feed more the Krebs cycle, then this will produce more ATP, and ATP will help the neuron to have a better conduction. And we have other type of strategies with drugs that may enhance the first steps in myelin production. These are mainly the synthesis of lipids, and maybe using some drugs like biotin with high doses may at the same time feed the Krebs cycle to enhance energy supply in a way, and in the other way enhance the first limiting step for lipid synthesis which is the synthesis of malonyl-CoA, which is the first fatty acid that is involved in myelin.